Connect for Health Colorado is the state-based insurance marketplace. We see people who are self-employed. We see contracted workers. There's people who work in restaurants or retail who think that because their employer isn't providing them health insurance and they don't qualify for Medicaid, that there's no option for them, that the only option is a very expensive health insurance plan. And we want people to know that they can come through the exchange and likely get that financial help to lower the premium so that they can have health insurance and take care of themselves. A lot of people assume they don't qualify and that they won't be able to afford it when really we do have these affordability programs to help them out. We offer tax credits that lower your monthly premium, and we also have what we call cost sharing reductions, and those help lower your out-of-pocket costs like your prescriptions or your co-pays and things like that.
In this region of the state, we've always had a fairly high amount of uninsured individuals, and since the Affordable Care Act and since Connect for Health came in, a lot more people have health insurance, and because they have health insurance, they're actually able to seek medical care. So it does make for a much healthier community. One of my first clients, I remember from my very first year, I had a client come in, self-employed, mid to late 30s. He hadn't had health insurance since he was like 18. He had diabetes, and so he was never able to buy private insurance. And since he ran his own business, he didn't have an employer to offer him health insurance, so I was able to help him get financial assistance and help him purchase health insurance for the first time. So that was a great thing, because then he can actually go to a specialist and seek out that medical attention for his diabetes and not have to worry about not being insured. Most people just think, oh, I'm not going to qualify, I make too much money. There's so many different types of financial help out there that a large amount of people actually do qualify, and if for some reason you don't qualify, we can still show you plans, and you might still be surprised that they are affordable. I had one family actually that was paying about $2,000 a month for their premium, and they're a family of 5. $2,000 a month, that's more than most mortgage payments are down in this area. And they weren't sure if they'd qualify or even if they'd qualify for help, but we found out they would, and saved them well over $1,000. That's my favorite part about my job. Saving people money and making it easier for them to access what they need.
The mission of Connect for Health Colorado is to increase access to and affordability of health insurance. One of our main strategic goals is to increase the access and affordability in rural areas. As the community outreach manager, it's important for me to work with people who are a part of the community and trusted by the community, and Action 22 and Pueblo Get Covered can help me identify where we need to be, where there's a gap in understanding or a gap in knowledge about the affordability programs that are available. The easiest way to find out what's available to you is to go to our website, www.connectforhealthco.com, and click Get Help.